Hello everyone, this is Dr. David. You can call me Margarita. Today we have a special guest. He would not leave me alone for the filming, so I figured I'd introduce him. His name is Coco. He's my little dog, and he is wherever I am. So, all right. So today we're going to cover arterial blood gas, also known as ABG. This is a big topic that's highly requested among students. I'm going to divide this video into two parts. One is going to cover this information, which is going to give you a background on what ABG is, and I'm going to slightly cover compensation, and then we're going to do some ABG interpretations. So I don't want you to look at this side of the board. I want you to focus on this side. In the next video, we're going to cover compensation, and I'm going to expand on different respiratory acidosis and alkalosis, as well as metabolic acidosis and alkalosis. Arterial blood gas, ABG, is a blood gas analysis that is drawn from the artery of a patient. That is different than when a patient is drawn a CVC or a Chem7, which comes from a vein. This is going to give us the information that we need in order to interpret our ABG results. The ABGs are drawn in order to monitor these elements: the pH, which tells us how acidic and alkaline the blood is, CO2, HCO3, also known as bicarb or the buffer, and PaO2, which is going to tell us the oxygen saturation of your blood. At all times, all of these three parameters, the bicarb, HCO3, the O2, the pH, and the CO2 must be in balance. If they are not, it can cause significant effects in your patient. So we must always have them in balance, and this is called homeostasis. The body always have to have some type of balance. Just like when we talked about fluids, where if there's an electrolyte imbalance, we have to fix it because the body cannot function with an imbalance. Now, there are two organ systems that control this balance, that they maintain it. Can you tell me which ones they are? Well, the two systems that maintain ABG balance between HCO3, O2, pH, and CO2 include the kidneys and your lungs. So for each, there are parameters, and they match these up here. So below are the ABG parameters that we're going to be looking at when we get an ABG result. I want you to tell me which one matches the CO2 parameter. And as you know, CO2 is exchanged in your lungs. So this is a respiratory parameter. So when we're looking at an ABG and we look at the CO2, it's going to tell us how well the lungs are exchanging carbon dioxide. Then we have bicarb, HCO3, and that is a parameter that is maintained by the kidneys. Then we have the pH, and how I set up here, the pH level in an ABG result is going to tell us how acidic or alkaline the blood is. The PaO2 is going to tell us how much oxygen is in your blood. The range for this should always be between 80 and 100 millimeters of mercury. If at any time it falls under the normal of 80, this can be hypoxia. So your patient is not receiving enough oxygen. There's not enough oxygen saturation to be able to perfuse your body. So perfusion. Now, why do we need to know these parameters? So why are these parameters important? Well, from these, we can determine if the person that you are evaluating is going through either respiratory acidosis or alkalosis, or metabolic acidosis or alkalosis. To briefly go over these terms, which I'm going to follow up in a following video, when you have respiratory acidosis, The extra CO2 that is roaming in your body is going to combine with water and is going to create carbonic acid. This makes it an acidic environment. So an increase in CO2, as we're going to go over here, an increase in CO2, which is a CO2 greater than 45, is going to increase the amount of acid, which means that the pH level decreases. The lower the pH, the more acidic it is. So in respiratory acidosis, which is the case in a person that has emphysema or COPD, where they're retaining CO2, they don't have proper exchange in the lungs, they're going to have an increase in the CO2 level, in turn a decrease in their pH, making it more acidic. In respiratory alkalosis, you have extra excretion of CO2. So the CO2 level here is decreased. This can happen in a situation where the patient is hyperventilating. For example, if they have an anxiety attack, if they're breathing too fast, they're excreting too much CO2, so they become alkalotic. In metabolic acidosis, you have a decrease in bicarb, or HCO3, which is the buffer for the body, which leads to an increase in lactic acid. This in turn causes the pH of the blood to decrease, making it more acidic. So here we have metabolic acidosis. So there's too much bicarb. So bicarb drops, which means that the HCO3 is low, or like we look here, the range is 22 to 26. So in this case, the bicarb drops, making it an acidic environment. A case that you can see in the hospital or in your facility of a patient that has metabolic acidosis would be someone that's going through renal failure, where their kidneys are unable to filter out their blood, so the toxins build up, and the patient eventually will need treatment, for example, dialysis. So they are in an acidic environment. Then you have metabolic alkalosis. This is when there's an increase in bicarb, or your HCO3, and it causes your blood pH to go up, making it alkaline. So in metabolic alkalosis, there's an increase in bicarb, as well as an increase in blood pH. One particular patient scenario that you may see with metabolic alkalosis would be someone with NG tube suctioning, or has excessive vomiting, or is coming in because they are extremely dehydrated. So different than acidosis, where they're retaining all these toxins, making an acidic environment, in alkalosis, there's too much excretion, making it a more alkaline environment. Now let's just review before we go into ABG interpretation. So arterial blood gases, also known as ABG, is a blood gas analysis that is drawn from the artery of the patient, and it monitors pH, CO2, HCO3, which is bicarb, as well as PaO2, which tells us how much oxygen saturation is in your blood. At all times, all of these four parameters must be in balance in order to keep the body in homeostasis. The two organ systems that maintain this balance include your lungs, or respiratory system, which is in charge of your CO2 level, your kidneys, which is in charge of your bicarb, or HCO3, and your pH tells us how much alkaline or acid is in your blood at a given time. The PaO2 tells us how much oxygen saturation you have in your blood, and at all times, it must remain between 80 and 100 to have enough oxygen concentration. If the O2 level in your blood, arterial blood, drops below 80, that can mean hypoxia. So what can you do in those types of patients? They determine from these numbers if the patient needs additional oxygen. So these parameters are very important in order to determine if the person is under respiratory acidosis or alkalosis, or metabolic acidosis or alkalosis. And how we discussed, someone that is in respiratory acidosis has extra CO2 roaming around, which combines with water and creates carbonic acid, making it a more acidic environment. In turn, the pH level drops because a lower pH, which is under 7.35, is acidic. In respiratory alkalosis, you might have a patient that's breathing too fast, so they are excreting excessive amounts of CO2, like someone that's having an anxiety attack. So in this case, you have alkalosis, and the pH increases. In metabolic acidosis, you have a decrease in bicarb, which in turn increases lactic acid, which is the case in someone that's going through kidney failure, where they're unable to filter the blood of all those toxins, making it a more acidic environment. Here you will also see that the pH is lower than 7.35, which is acidic. In metabolic alkalosis, which is where there's an increase in bicarb, hence increasing the blood pH, you may see a patient that is excessively vomiting, has dehydration, or is getting excessive NG suction. Now we're going to go over ABG interpretations. The number one rule in order to understand these parameters is that you have to memorize the normals. You cannot interpret any result that you may get from your patients if you do not know the normal levels. Now we're going to go over the fun part, ABG interpretation. So all of this information that I've gathered, we're going to get a result for our patient. And in order to be able to interpret those results to determine if the patient is under respiratory acidosis or alkalosis or metabolic acidosis or alkalosis, we need to know the normal values in order to know the abnormals. For example, the pH range is 7.35 to 7.45. So the pH in your blood must always be within this normal range. Anything below 7.35 is considered acidic. Anything above 7.45 is considered alkalosis. When looking at the CO2 level, you have to be between 35 and 45. Anything below 35 is considered alkalosis, and anything above 45 is considered acidic. When looking at the bicarb or the HCO3, anything below 22 is considered acidic because the range is 22 to 26, and anything above 26 is considered alkalosis. You have to memorize these normal ranges. That is number one priority, because knowing these normal ranges, you are able to understand when you get these abnormal results, when you have an ABG in front of you, and that way you can plug them in. So here I have 3 examples that we're going to be going over, and one of the methods that I find to be the most fun is the tic-tac-toe method. One way that I remember how to do this method is by saying tic-tac-toe 3 in a row, which means just like when you play tic-tac-toe, you win when you have 3 in a row. So if you have the X's, you win. It's the same exact thing. So if I'm going to be plugging in numbers, whichever row has 3 in a row, that's going to tell us if we are in either respiratory acidosis or alkalosis or metabolic acidosis or alkalosis. So we have 3 examples here. One of the examples includes compensation, because I want you to know that the body tries to help itself. So that is a concept that, although I'll be expanding in another video, I can briefly discuss it here in order for you to understand the example. I'm always asked this question because partial compensation and full compensation can be a difficult concept for some students. How the body is trying to help itself come into balance, it's going to try to help. For example, if you have a respiratory problem that is not being treated or is not getting better, the metabolic bicarb or HCO3 is going to try to help. The same goes when there's a metabolic problem where it's not being treated or it's not getting better, the respiratory parameter of CO2 is going to try to help. What does that mean? That if my bicarb is still abnormal, the CO2 is going to not be normal anymore. It's going to be in an abnormal range. Because normally when you have either metabolic acidosis or metabolic alkalosis, CO2 should always be within normal range. When there is partial compensation, it gets out of that range. And then you're going to ask me, what does it mean to be in full compensation? Simple. In full compensation, not only are you going to have either the metabolic or the respiratory parameters helping, but also you're going to receive the help of your pH. So your pH is going to return back to its normal range between 7.35 and 7.45. Because when it is either respiratory acidosis or alkalosis or metabolic acidosis or alkalosis, the pH is either acidic or alkaline. But when it is fully compensated, not only are you going to have the help of either the bicarb or CO2, but now the pH is going to be between 7.35 and 7.45. That is what full compensation means. So let's get back to these examples. So we're going to do example number 1, but first there are steps to plug in these values. So the first step is to look at your pH level. So you need to determine if the pH is normal, acidosis, or alkalosis. Once you determine that, you're going to plug it in wherever it belongs in these columns. Then you're going to look at the CO2 level. So is the CO2 level normal, acidotic, or alkaline? And then you're going to plug it into its particular column. Then you're going to look at the bicarb, HCO3. So is it normal, acidotic, or alkaline? And then you're going to also plug it in. And once you have 3 in a row, that will tell you which one is it, respiratory or metabolic acidosis or alkalosis that you have in your patient. So we're going to get started. The first example tells us that the pH is 7.50 and that the CO2 is 38 and that the bicarb HCO3 is 32. So let's start plugging them in. So our pH is 7.50. So is this within the normal range of 7.35 to 7.45, or is it under 7.35, which makes it acidic, or over 7.45, which makes it alkalosis? Well, this number is 7.50, which means that is over the maximum range of 7.45, so it is an alkalosis environment. So I'm going to plug that in under the alkalosis column. Now we look at the CO2. So the CO2 in this example is 38. The normal range for CO2 is 35 to 45. Anything under 35 is alkalosis, and anything above 45 is acidic. So looking at this number of 38, we can see that it falls within the normal range of 35 to 45. So we will plug it in. Then we go to bicarb. So bicarb HCO3 is 32. The normal range for bicarb is 22 to 26. Anything below 22 is acidic, and anything above 26 is alkalosis. So being that the number is 32, it falls over the maximum range of 26, making it an alkaline environment. So we will plug it in into the alkalosis column. And now we have a complete table. So we have the CO2 in the normal range, and then we have the bicarb on their alkalosis and the pH on their alkalosis. And remember what I said, tic-tac-toe, 3 in a row. So here we have 3 in a row, making this a metabolic, because the parameter for the metabolic system is your bicarb in your kidneys. and you can either be acidotic or alkaline. So here we have metabolic alkalosis as our answer. And the CO2 is normal because the system that is working now is your kidneys. So the answer for example number 1 is metabolic alkalosis. Now we're going to do the following problem. So in this example, we have a pH level of 7.29, a CO2 of 49, and a bicarb or HCO3 of 23. So looking at our normal ranges, the pH falls within 7.35 to 7.45. And here we have a pH of 7.29. So this is considered under the minimum range of 7.35, making it an acidic environment. So I'm going to plug in our pH under acidosis. Then we have the CO2 level. So the CO2 level is 49. The normal range for CO2 is 35 to 45. Anything over 45 is acidic. Anything under 35 is alkaline. So in this case, our example is 49. So it falls under the acidic column, and that's where we will plug it in. Then we have bicarb being 23. The normal range for bicarb is 22 to 26. So we see that it's 23. So it falls within normal range, which means that it's normal. It's not either acidic or alkaline. So I'm going to put it under the normal column. So as you can see, we have 3 in a row under acidosis. So we have acidosis, and we have CO2 in this column as well, which means it's a respiratory issue. So here we have that the pH is acidic and the CO2 as well. So this is respiratory acidosis. And the bicarb HCO3 is normal. So for our second example, it is respiratory acidosis. Now we're going to do the third example. Here you're going to notice a change because I wanted to show you an example of what compensation looks like. Because again, the body always tries to keep you in homeostasis, in a balance. So in this example, we have a pH level of 7.30, a CO2 of 48, and a bicarb of 29. So let's plug in our pH value. Knowing that our range is 7.35 to 7.45, and our example is 7.30, it is an acid. So we're going to plug it in under the acidosis column. Then we have a CO2 level of 48. Our normal range of the CO2 is 35 to 45. Being that this is 48, it is over our maximum range, making it acidic. So we will plug it in into the acidosis column. Then we have a number for bicarb of 29. The normal range for bicarb is 22 to 26. Anything over is alkalosis and anything under is acid. Being that this is 29, it is considered an alkalosis environment. So I'm going to plug it in into the alkalosis column. As you can see, something looks different. In the previous examples, you had the opposites in the normal column. So when it was metabolic alkalosis, you had CO2 in the normal column. When it was respiratory acidosis, you had the bicarb in the normal column. What is this showing you? This is showing you that the bicarb or your kidneys are trying to help bring the body in balance. Therefore, it's going to move from its normal range of 22 to 26, and it's going to change in order to help. So here we have a respiratory acidosis patient with partial compensation of bicarb. That is what partial compensation is. Now, if we wanted to see a patient that has full compensation, then what do you think the pH was going to be? At this point, the pH would also change, but instead of changing into less than the 7.35 or greater than the 7.45, which normally would be the case, it would be in the normal range. So whenever the pH is in the normal range, that is called full compensation. So partial compensation is when either the bicarb or the CO2 change to the abnormal range when they're trying to help each other. Full compensation is when in addition to those, they have the pH also helping become normalized. Now, how I said earlier, it is very important for you to memorize these values. You have to know what the normal pH is, what the normal CO2 is, and the normal bicarb, because without knowing these normal ranges, you will not be able to interpret when you have a patient result in front of you. So I hope that you find this information useful for you. It is a highly requested topic. I'm going to expand on this topic covering respiratory metabolic acidosis and alkalosis in future videos. I'm also going to be doing one on compensation. Look forward a video regarding a bunch of questions that I'm going to put up to go over this acid-base balance, and make sure that you're putting your suggestions of what future topics you want me to cover in the comments below. Make sure to like this video and share it with your friends. Also, we're going to be having a website. It's almost completed under drregisterednurse.com. And there you're going to find a bunch of quizzes, a bunch of career tips, NCLEX questions, a blog about the things that I see normally in clinical with students that will help you out. I'm also going to include a bunch of study guides. I'm a very visual learner, so I know that there are a lot of people out there that are the same as me, and they're going to be extremely helpful. It should be opening up in the next few days. I'm just finishing it up, giving the last shabby chic touches. Well, thank you for your time again, and have a great rest of your week. Bye.